Cuyahoga County Committee of the Whole meeting for Monday, November 25th is now called to order. Andre, would you please call the roll?
Good afternoon, everyone. It is 1:06 p.m. and as a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Mr. Byrne.
Here.
Mr. Gallagher. Mr. Schran. Mr. Schran is absent at the moment. Ms. Conwell is absent at the moment. Ms. Turner.
Present.
Ms. Stevens is absent at the moment. Ms. Simon is absent at the moment. Mr. Kelly.
Here.
Mr. Miller.
Present.
Mr. Sweeney.
Present.
Council President Jones.
Here.
You have a quorum.
All right. Andre, has anyone signed in for public comment?
No public comment has been submitted.
All right. Well, at this time, I'm going to pass the gavel to Councilman Miller, our Chair of Finance, and he will lead us in our budget hearing process. All right.
What's up for now? At 3 o'clock.
Thank you. Thank you very much, Mr. President, and I would ask the clerk to please read the resolution into the record.
Resolution 2024-0407, adopting the 2024-2025 biennial operating budget and capital improvements program annual update for 2025.
Thank you very much. And first on our agenda is the Sheriff's Office, Sheriff Patel.
Good morning, Council, or good afternoon now. I just want to thank you for your support, your attention over this past 17 months I've been here, and in preparation for today's hearing. Gone over a lot of different points, a lot of things here, but I'd like to start off with a quick presentation, some highlights from the department, and then we can get to the crunchy numbers section of this. But I want to start off by thanking you for your support during this time with the various things that we've covered with. So. Clicker, sorry, yeah. Thank you. Awesome. Before we get going, I just want to go over some of the top priorities which are important in building the premier law enforcement agency in the state of Ohio and beyond, something you've heard me say before, but it's important, and those aren't just words. It's true because we're in a unique situation here with our agency where we can transform into something. And I also want to say, as we talk about this, the Sheriff's Department is your Sheriff's Department. It is the executive team's Sheriff's Department. It's the county's Sheriff's Department. It is our Sheriff's Department. So it's not just my Sheriff's Department, but important for us to know when something happens, it affects all of us. So that's why we look forward to all of you for support in building this as we go forward. Having said that, I really recognize that the morale, part and parcel, and certainly front and center thing to address, and that's something we've been working on since I've been here. Updating and familiarizing staff with policies and practices. That is something that was critical to our operation. A total look at our policies, and we have a policy unit that's working very diligently on updating as many as we can in concert and support, obviously, of the Ohio Collaborative and just making good practice. But that's something that, going full bore on, I want you to be aware of that. I recognize there were some gaps there that needed to be addressed, and that's what we're doing now. Examining and improving the organizational structure. The structure needed some tweaking. We have a lot of great people here, a lot of experience, a lot of team members that know their job very well, have a level of commitment, and then we just needed to move some folks around and move some programs around. That's the way I did. Staffing accordingly, obviously, is always important. Reducing risk, increasing our service level, and that's something that we can do at every turn. Something as simple as if one of the residents in a correctional facility may need something notarized. Providing a basic service like that is something that we need to address. A lot of times people look at things that Reasons why not? Well, we look at reasons why. Why do we say no, or why can't we do something? We should do things that are within our ability. And just, again, I mentioned risk reduction, which is always important, but it improves our, when I say, I'll say it again, it's a collective our Sheriff's Department. I want you to make sure that we're all very clear on that. I'm going to go through a few of the units here. Civil Division, just to give you a quick shout out. I'm not going to read every single thing to you, but just give you, putting up on the screen, and you already have it, speaks to the staffing there. But most importantly, what this speaks to is to the amount of work that comes through. A lot of people are unfamiliar with the functions of the Civil Division and how much they touch, how much they serve our community, and how integral they are to our process. We talk about subpoenas, defense subpoenas, summonses, writs, all of this by a small crew of committed individuals. And that's something that people don't really recognize. There are members of our professional staff, and there are also 2 members there that staff the concealed carry permit office, which again is a statutory requirement for all sheriff's offices, doing a super job there. And again, a lot of folks think that with the change of the law, that requirement has gone down, and that's not true, because it's important for people to have reciprocity to have a concealed carry permit in the state of Ohio. So I'll leave it at that. Correction Center. Average daily counts, roughly 1,550. Yesterday, we were at just under 1,500. Important to know how many residents come through there and what our responsibilities are. We've talked about classification with our residents. You know, many of them have higher classifications. We know that many have meal requirements. We know that there's medical issues, a lot of things. So it's a lot going on under our responsibility. About 656 corrections officers that are committed to making this mission work. And it's just a lot of people here doing a lot of great work. 10 canine teams. Bring them. I'm very proud once again. Appreciate Councilman Kelly and Councilman Simon with their support with getting the canines up and running, and the executives team with facilitating the finalization of that team in their deployment. The reason there's 10, there's 4 access to the correction center. I mention that because it's important that we're aware. We were mindful there's 4 access points. They must all be covered to save lives in our correction center. Those canine teams are saving lives by working those 4 access points. And this is a 24/7 operation. Electronic monitoring unit, probably one of our newest, not really new now at this point, I think they're over 12 years old, but it's a unit that's something really novel, really good, really positive thing on behalf of the county to do to make sure that we can reduce the population in the correctional center by having people out here, but have a monitoring system. That's terrific. However, as we know, it doesn't always come easy. It started at probably less than half of this. Now it's increased to 605 clients and nearly 2 million alerts, 1,600 installations, a lot of repairs and replacements, and 230 home checks. This is important because with all of these functions, there's a degree of risk. A judge and prosecutor and probably the clerk's office collaborated to determine who's going to be on this, a probation department, and it's the sheriff's department job to make sure that those who are on the monitoring are doing what they're supposed to do and are where they're supposed to be and not where they're not supposed to be. When that is violated, it creates risk for all of us and certainly for citizens, and that's where the sheriff's department takes action. Downtown Safety Patrol, over 500 citizen contacts, over 60 requests from other agencies outside of the city of Cleveland for support, about 141 firearm seized this year. I can show you the arrests. I'll also show you the releases. These are people who were stopped. They had a warrant outside of our immediate downtown area, and the agency that had that warrant, let's say it could be Summit County, said, no, we don't want to arrest this guy right now, so we didn't. Felony named suspects, violation of state drug law, and the community impact, immeasurably positive by the people who live downtown. Protective Services, another one of our divisions. And as you know, they secure all buildings, including this one, do a super job there, provide additional courts service in the courts tower. 24-hour coverage to our county facilities. They are the unseen folks who keep things safe throughout the evening hours and deploy them all throughout the county at our buildings. Visible safety presence and force multiplier, not just downtown, but wherever they may be. Many times they are approached by citizens for assistance or direction, and they certainly respond in that. We've integrated them into our internal affairs, policy, and professional development section because they are part of it. They are part of our department. It's important that they be in these critical functions. And I want to bring your attention to where it says professional development section, formerly known as the training section. Yeah, training is important, so is education. We feel professional development is the proper term for that function. Special operations, 317 pounds of cocaine, 189 pounds of fentanyl, hash, huge amount of hash, 3,900 pounds of marijuana, 24 pounds of crack cocaine, and that's year to date, and that's just on the small end. But important to know that this poison did not enter our communities because of their work. So very hard work there, a lot of collaborative work, and good stuff there. Warrant unit, we have 3 deputies and a sergeant assigned, worked 235 cases, cleared roughly half of those, over about the 70% of those. 138 warrants arrested on the U.S. Marshals Task Force with the Sheriff's Department's representation there. 263 arrests, 175 violent offenders, 175. Not bad for 3 deputies and 1 sergeant. So that's kind of like the highlight of the agency. Now we're going to get to the budgetary part, but I want you to know that every dollar that we spent at the Sheriff's Department is a dollar that's really, you're getting a lot of, we, the residents of Cuyahoga County, are getting maximum mileage out of it. I can also tell you that you have a dedicated group of men and women at the Sheriff's Department that are here to serve our communities, every single one of our communities, every day, in the various capacities that they do. When assistance is necessary by someone else, whether it's one of the local police departments, whether it's one of the colleges, et cetera, they call the Sheriff's Department. The Sheriff's Department does not have primary 911 responsibility in this county, but they've served 911 in a different capacity. The capacity that when those who have primary 911 responsibility need assistance, we're who they call. That was evidence during the street takeovers. Cleveland Police gave us a call. It was evidence in many of the suburbs who call us for assistance, and we try and support those as much as we can. Local colleges call for assistance, so we are who they call when they need some assistance. And it's important that we support those efforts. So with that, I am prepared for your questions.
Thank you very much. We're going to call on Councilman Kelly first and then go on to our chairperson, Councilman Gallagher.
Thank you, Mr. Chairman. Sheriff, just a quick question on the electronic monitoring unit. How many people are assigned to that?
Through the chair to the councilman, 12 deputies and a sergeant.
For 2 million alerts?
Yes, through the chair to the councilman, the alerts could be an actual absconsion or someone is in an area they shouldn't be, or the alerts could be the battery's dead. Contact established, battery installed, good, but they do come through. Some are very simple, some are more complex, some have greater risk with them, obviously.
Okay. That's very important, especially for the domestic violence people. What kind of impact have you had with 12 deputies and a sergeant on making sure that people don't go where they're not supposed to?
Through the chair to the councilman, couple things, sir. The impact, they have been managing that, a lot of it through partnerships. Let's say that an individual is in a space they shouldn't be, particularly in a domestic violence situation. There's a survivor there and maybe they're encroaching in that space. The deputies will contact that local municipality when they and get their response also while the deputies respond. That's just to save time. If it happens in Rocky River, it saves time by the time they drive there. So it's all partnership. Like everything, you know, risk exists, but through our partnerships and through probably the better side is the good work that the deputies do with the clients ahead of time, getting to know the client, getting to know the family, speaking with them, et cetera, helps them lay the groundwork to reduce those.
Thank you, Mr. Chairman.
Councilman Gallagher.
Sheriff, welcome.
Thank you, sir.
Is 193,456,091 sufficient?
Through the chair to the councilman, I don't think any number near this ballpark is going to be sufficient, sir. It's going to be what we have to work with. I know that in past years, the number that has been agreed to has been a number proposed, number agreed to, and an actual. And I think this is at the halfway point, we're about that mark. But I know that I am very optimistic that when it comes to critical functions and necessary needs, that working with the executives team to get those filled. Obviously, we'll have to triage those and make the best of it as we can with the critical functions and make sure they're staffed.
Right. Last year, as you know, when you initially came up here and you were new, the administration took 20 million out of your budget for the overtime. We weren't happy about that. We added 6, they added 2, so you're at 12 down. You're coming in closer to 14 million underwater, of which I don't blame you. It was a shell game in budgeting, and we're back to the shell game. You are starting the year, next year, January 1, $8 million underwater. So I'm going to propose to council that we put $8 million into your budget. You need to start the year flush instead of the shell game that's been going on here. We've never done that before. I don't know why we did that. I'm certainly not going to vote for a budget that's not balanced. That was not balanced, and then you got whacked for that. And you heard me all year telling you, you're going to be back, you're going to be back. Well, we're going into savings to pay that off. That's not budgeting. That's a shell game. So you're back at it. So I'm going to propose that the council fill that hole. If they don't, I'm not voting for this budget. Also, in the budget, did you or the administration, I don't know if the administration wants to add this, did you factor in the downtown patrol, a potential impact unit? And I talked to Ms. Stevens today. She wants East Cleveland taken care of 3 days a week. Is that any of that been factored in other than East Cleveland and the impact unit? Has the downtown patrol been factored into this 193?
Through the chair to the councilman, I think it's been factored in as part of just the overall sheriff's budget, not a specific line item, but that's a discussion that we have ongoing as far as ways to support and supplement that unit.
So it wasn't, is what, because we dealt with that last year, and it added to your deficit. So I'm also going to propose to council that we line item the downtown patrol in. The administration seems to believe, and you do also, that it's a very important piece of our providing services to those that need it. And this so happens to be Cleveland, who refuses to pay for it. So if the administration so feels it's that important, we will line item it in to the tune of $1.350 million, so you can provide those services. And if it's that important to the administration, they will put that money in. If they do not, you then are going to be on the hook for any dollar spent outside your budget for a downtown patrol. Personally, I wouldn't do it, because I don't have 1.35 million. I know you've been very successful in your life, but I'm guessing you don't have 1.35 million in a couch somewhere. Also, if we're going to do an impact unit, which this council agrees on and in the past has funded, we should line item, which will be about $2.3 million as the impact unit. And that's going to be incumbent upon us to find that money. And if we go forward and help in East Cleveland out like Ms. Stevens would ask us to do, and she'll be here a little bit later on and may talk about that after you're gone, that's $300,000. We would have to, with the administration, find those dollars. Enough spending outside the budget. That's not budgeting. That's not your fault. You got stuck with it. And now we're doing this little, I don't know what we're doing with the open spots and putting those on the side. I don't know how we're going to deal with that. We're going to have to go through that. So, my colleagues, that's what I'm going to suggest we do. If we do not do it, I will not vote for this budget. I will not vote for a unbalanced budget. It will be unbalanced if it goes forward as is right now. And then we will all be held personally responsible and subjected to a taxpayer's lawsuit. And I just might be that taxpayer. I've had it. This is unacceptable. We've never done it in the past. I've done over 14 budgets in my political career. Last year was the first year we were not balanced. Going in. Things happen, I understand that. But this was a planned, unbalanced budget. It's got to stop. And if all of these little extracurriculars are important to us or the administration, it's incumbent upon us to find the dollars to fill those holes. Not your job, that's our job. So I apologize for what you went through all last year, having to listen to me, reminding you that sometime in November of this year, you're going to be coming back hat in hand. And it came true. And the same thing's going to happen next year if we move forward on a budget of 193, unless we cut off all the things that aren't supposed to be in here, fill the $8 million hole, and then we move forward. And then, quite honestly, Sheriff, at that point, you've got no excuses. But right now, you've been handed an $8 million excuse on top of all these other millions of dollars that we're going to find or the administration's going to find. Indeed, if it's important to us. That's all I have. I appreciate your patience with me during this. I know you were put in a bad spot. You were put in a bad spot again this year, and that's not fair to you. So my hope is that this council will wake up, line item these things in there, and then we move forward with you with a balanced budget. It's only fair to everybody, especially the taxpayers of this county who have no idea of this movement of dollars that are outside the budget, as far as I'm concerned. So let's work together, move together. We'll work with the administration. They're certainly not going to be happy with me today. I really don't care. My job is to provide a balanced budget of the to the taxpayers of Cuyahoga County, and we did not do that last year. Going forward, that cannot happen. Thank you.
So, to the councilman, just a question. Do you consider the 2.35 million for the impact unit as in addition to the downtown patrol, that they're two separate things?
The downtown patrol was always separate, was never budgeted. The impact unit, which we've done in the past, and we have paid for that gladly because of the spread out services to communities involved in Cuyahoga County. Everybody had a shot at it. Not everybody used it, but those most in need got it, and it worked wonderfully. That's an extra. And if we're going to do that, I know Cheryl's going to want to talk about East Cleveland, and that's roughly about $300,000. So on top of the $8 million that he's underwater right now, you're adding another 1, 2, 3, roughly 3.7, 3.6 more. So it's more.
Okay. Councilman Sweeney.
Thank you, Mr. Chairman. Thank you for your presentation there, Sheriff. How you doing today?
Good, sir, yourself?
Just 3 questions from your president. Foreign court, just remind me what that is?
A court, not Cuyahoga County, one of the suburban courts or another court from another jurisdiction.
Okay, that's a pretty powerful word. It's foreign. I'm like, okay, where are we going with that? But thank you. And through the chair, the notary. This council, maybe 3 years ago, some gentleman came by to all of us and started talking about how he couldn't get to his client to have this notarized for a piece of paper that dealt with his family stuff, with his mother's house. And I've been chirping about it ever since. And I had the privilege of talking to you, and guess what? It's part of the budget and it's going to be done. Those small little details for the quality of life of the people inside, but also be able to function in their outside world. So thank you for that. And the one question is, you got a whole bunch of drugs off the street. How much drugs did you keep out of the jail?
Through the chair, to the councilman, that number can't be measured, sir, because obviously it's like a car driving by at night. How many burglaries did it stop? We don't know what the presence did, but I know that the reduction in incidents and overdoses since the implementation of the correctional canine screening program certainly evidenced that.
And through the chair, let me rephrase it. How much drugs did you take from the people trying to smuggle it in?
Through the chair, to the councilman, very small, minute of actual drugs, found vape pens, perfume, different things that didn't belong there, but actually for drugs, nowhere near these numbers, sir. I think it's more of a deterrent effect with the staff members, which is primarily what that's focused on. The other place that we did seize narcotics was people coming in from the outside who wanted to conceal it on their person,
That's what I
small
saw.
amount there.
Small, okay. And thank you, and that's, I want to applaud you, keep up the great work, and once people know that you're in charge, they're not even going to try it. So that's a credit to you. So thank you very much, and Mr. Chairman, I appreciate the opportunity. Thank you.
So, for the record, Councilman Tron is now in attendance, and next is Councilman Byrne.
Thank you, Mr. Chair. Sheriff, how are you?
I'll let you know, sir. Thank you. Yourself.
This should be easy for you. Couple questions regarding the electronic monitoring unit. Who pays for the units, the client or your department?
Through the chair to the councilman. I think there's some part that comes, involves probation. Not sure what the amount is, but other than that, it's the department.
It's the department picks it up. Do you know what the cost per unit would be?
Through the chair to the councilman, I don't have that. Someone on my staff may have it, so if you give me a minute. So,
That's fine.
If not.
And then who does the installations?
Can you get that information to the councilman?
Absolutely.
Thank you.
Thank you, Sheriff, and thank you, Mr. Chair. And then who does the installations and the monitoring? Is that monitored by your department or the company that has the monitoring devices?
Through the chair to the councilman, by deputy sheriffs in the Justice Center, sir. That's a central dispatch. Those 12 deputies work 24/7. They are the ones responsible for those functions.
So your 12 deputies and one sergeant monitor all of the units that are 605 that are out there?
Yes, sir.
Wow. And I'm sorry, about installations, do you install or does the company that has the units install?
No, through the chair to the councilman, deputies do.
Okay, thank you. Thank you, Mr. Chair.
Yes, go ahead.
Through the chair, in the civil division where you mentioned the 42,171 state subpoenas,
Yes.
does the state provide any type of support to help you execute these?
Through the chair to the councilwoman, I'll have to get back to you on that. Excuse me. I'm not certain. I know there was some reimbursement for some of the functions. Don't know if that's one of them, but I will get back to you on that.
Okay, thank you.
Okay. Anything else? Council President.
Thank you, Mr. Chair. Sheriff, when you mentioned you addressed the morale for the staff, tell us some of the things that was specifically done that helped impact the morale.
Through the chair to the president, just a couple of things, sir, a few examples. One would be just starting at the very top, the fact that the engaged leadership will start with different units with the correctional facility, from the chief to the wardens, associate wardens, all the way down. The message was to the frontline supervisors, sergeants, and corporals that they have to be out there. That was well received by officers because there were situations where officers probably didn't see them enough, and there's a lot of work to be done there, but that certainly helped. The fact that if they had a concern with the resident, it would be addressed because they knew the corporal sergeant would be coming by very regularly. That was one help. Another one, just a conversation I had with one of our officers as I was walking through the facility, specifically about shift bids. When they have to come in and bid, they might be in an off-duty status, and they'd have to pay for parking to come in for 10 minutes and put in a shift bid. So hearing that, I reached out to Acting Chief Rivera and said, hey, is there something we can do about this? And we identified some parking by the courthouse. We put a 30-minute limit on it, and that worked very well for that week. Shift bids is only 1 week during that week and facilitated them. So we addressed one of their issues that was bugging everybody. All 600 of them had to deal with that. So that was just a small example. Another one would be a discussion we had about bringing food into the facility. Sometimes communication is key. As we move forward with our programs to reduce poison in our facility and reduce deaths, obviously part of that, one of the largest components is removing of people bringing in leftovers from home, food from home into the facility. So that discussion, I was talking with a couple of officers when I was walking through, and they identified to me that it was unfair that they would have to be subject to that, whereas staff could bring in whatever they wanted. And I informed them that they were misinformed. That was not the case. Everyone from the chief on down will be subject to the policy, and nobody will bring outside food to the facility, period. And when I informed them of that, their outlook instantly was, oh, okay, and just went on. The concern was more about the unfairness of it than it was about the application than it was about the fact of not bringing food in.
Thank you.
Thanks, sir.
Anything else? Okay. Thank you very much.
Thank you, sir. Thank you, counsel.
Okay, before we get to the next presentation, I'd like to call Director Parfiowitz forward. And also to note for the record that Ms. Conwell is joining us. You're just in time for the ADAMHS board. So, Director, two things. First, you explained to me that the administration has two amendments that you're going to bring forward regarding covering the cost of recently concluded collective bargaining agreements. Can you brief us on that, please?
Absolutely. Walter Perfouts from the Budget Office. So the administration proposes two amendments. Both are CBA agreements or adjustments that were approved by council, CBA agreements. The first one is Health and Human Services. It's child support enforcement. The CBA adjustment is roughly $1.5 million in pay increases. So this adjustment impacts both the levy dollars and also special revenue funds. The levy impact is roughly $500,000, and the impact to the special revenue fund is almost $1 million, $985,788. The second is has to do with the sheriff's office. It's the protective service officer adjustment, also recently approved, $1,231,537. This impacts Sheriff Central Security Fund. It's an internal service fund that basically is charged back to all county funds at the end of each year. These are the two adjustments.
Okay, thank you. The other thing that I want to ask about, and I regret that our colleague stepped out momentarily, but am I correct that in a formal sense that we don't budget for programs? The budget only includes personnel and other, and that's all that's in the resolution. Am I correct about that?
Councilman Miller, you are correct.
So my follow-up question to that is that to what extent is there an understanding between the administration and the departments and the council about programs of the size that we were talking about, like the downtown patrol for 1.35, the impact unit for 2.35, and the East Cleveland for 300,000, that if those items are included in the budget, that the department would have presented that we're asking for money which includes these programs, and the programs would be listed so that there's an understanding of the specific programs that we're funding when we agree to a budget number, or are the departments not expected to say what their specific programs are, and the money provided can be allocated to programs at the director's discretion?
Council Miller, I would say that they're allocated based on director discretion. I mean, we budget based on what they've had historically, and then we add staff. Like, for example, in this budget, we add staff for hires that are in process and also vacancies. How they're allocated to programs is really upon the director.
Okay, thank you. I think you heard enough of the end of that, T.
I think I did to continue the discussion. You're talking about services such as like Dever cleaning sewers out in Rocky River. Well, we got an MOU to go out there and do their sewers and, move on. He doesn't go outside his budget. Nobody goes outside their budget without permission. Nobody.
I understand that, yes.
Well, that happened. That happened last year to the tune of what I'm being told is over $12 million. And evidently, I'm the only guy that cares. This was done purposefully. It continued on. I kept asking the question, in essence, building a record for any citizen out there that might find this odd. It can't continue. I have never been part of a process like this. If you want to provide services, that's fine. Show me the money. If we want to provide an impact unit, which I think we all agree on, we're going to have to dig and find the money. But when you're underwater purposely, and it gets worse purposefully, that's not a budget. You know, I was quoted in the paper the other day and it made me look bad, which is okay with me, doing your friends favors at taking a shot at the sheriff. It wasn't a shot at the sheriff. It was a shot at the administration. It seems the table in this county is tilted towards Cleveland and providing services and favors for Cleveland, who, as we sit here today, sticks us in the back every day. I'm sick and tired of that. So it isn't the sheriff outside his budget, it's the administration outside his budget with evidently the okay of the council. And I'm not okay with that. I think it's only fair. There's nobody else. There's not another division in this county that does this. So I don't know why we're balancing, telling the world we have a balanced budget to the masses in Cuyahoga County, pat us on the back, when we knew he was coming in at 12 to 14 million under. We knew it.
So, Councilman, respectfully, every 2 weeks we amend the budget with fiscal agenda items, and lots of these are items where other departments are also over their budget, not to the same numerical degree as this one, but to say that this is the only division where this is happening is just not an accurate statement.
That's not what I said. What I said, without permission. Do you have an example of somebody that just does it without coming for permission? I'll wait. That's what I thought. That's what I thought. There's a process, sir. There's a process, and I understand the process. Not one time has anybody come to the Board of Control to get money for a downtown patrol. Not once. Not one time. Not one time. This is unacceptable behavior, and not on the part of the sheriff. We're part of this, and I want nothing to do with it anymore. If we're going to go out there and spend money and do favors, and I stress the word favors, then you better find the money. Going forward, find the money. Nobody came to Board of Control for downtown patrol. Never. And it's not him sitting there that's the problem. It's not. This is outrageous behavior. And I'll reserve the time for you to tell me who, other than the sheriff's department that has no control over it, has asked for money for the downtown patrol or anything else. We don't deny people anything. The courts have come to us in mid-budgets with requests. We've always granted them. We've found a way. We have reserves. They could have done that. They could have dipped in. But I'll wait. I'll wait for the one division other than the sheriff's office that just does this. Nobody does it. Nobody. And you know it.
Okay. Thank you, Director.
You're welcome, Councilman Miller.
Next, we have Alcohol, Drug, and Addiction and Mental Health Services Board, Chief Financial Officer Felicia Harrison.
Good afternoon. Felicia Harrison, Chief Financial Officer for the ADAMHS Board. Along with me, I have Claire Rosser, who is our Chief Strategy and Performance Officer. And I'd also like to introduce the other members of our executive team, which includes Latoya Hunter-Hayes, who is our Chief External Affairs, Colleen O'Malley, who is our new Assistant Chief Clinical Officer. She's new and has only been there like a week, so trial by fire. Also with us today is Danielle Clark, our Director of Finance and Business Operations, and Dr. Bob Fowler, the Chair of our Board of Directors. So thank you for allowing us to come before you and present. So I'll just get started. So the Adams Board of Cuyahoga County is charged to plan, fund, and monitor the local system of mental health, addiction, prevention, treatment, and recovery services. One thing I would like to draw to your attention, this year we did receive our recertification from our state trade organization. It's called the Culture of Quality, which represents 142 standards of excellence for Adams boards across the state. So now I'll jump right into the numbers. In 2024, our projected expenses are roughly $82 million. And of that, 80% of our projected expenses for the year go towards direct services for consumers in Cuyahoga County. You'll notice that on the revenue side, the vast majority of our revenue does come from the HHS levy. The next slide goes into what's been a pretty big topic of conversation for the Adams Board is our cash balance analysis. At the end of 2024, our projected cash balance will be just over $22 million. And then if you will notice that the activity during 2025, our projected revenue will be just over $69 million. Our projected expenses, $84 million, leaving us with a projected year-end balance at the end of 2025 of just over $7 million. So now I'm going to jump into a couple of initiatives that we have been working on. So the state Ohio Department of Mental Health and Addiction Services has been emphasizing the enhancement and expansion of crisis continuum services across the state. This really is in response to local needs. Some of the initiatives that we have been working on are the Step Up, Step Down residential facility, the Care Response pilot, continuing operations of a psychiatric emergency department, and planning for a new crisis receiving center. So I'll just give you a few minor points from each of those major initiatives. So the Step Up, Step Down residential facility was opened this year. Signature Health is operating that for us at East 30th and Prospect. This is a facility where clients are discharged from hospitals that are still requiring stabilization before returning into the community, and/or clients just needing stabilization that are not linked to any hospital stays. They can stay at the Step Up, Step Down facility for up to 90 days. The Care Response Project, this is where we deploy teams of behavioral health professionals and peers with lived experience. We're utilizing Frontline Service as the provider agency, and this is in response to mental health crisis within the community. This project allows us to reserve police involvement for situations where public safety is at risk. We did have a soft launch of the program in September. We're working with the City of Cleveland Department of Public Health, and the launch has taken place in zip codes 44102 and 44105 for this pilot. The next initiative, as I indicated, was to continue operation of a psychiatric emergency department. So Metro Health is operating a psychiatric emergency department, or what we call a PD, in Cleveland Heights after the closure of the St. Vincent facility. This still allows us to have high-quality psychiatric crisis intervention care for a very vulnerable population. And this, the Psychiatric Emergency Department is located within Metro Health's Behavioral Health Hospital. The final big initiative that we've been working on is planning for a comprehensive crisis center. We did secure $6.8 million in one-time ARPA capital funds from Ohio MAS to establish this crisis center. The centers will operate the facility at 2322 East 22nd Street. This is the site of the former St. Vincent facility. The crisis center will include crisis intake receiving center, which is 40 beds, and that's in quotation marks because it's really a 24/7 living room model, which includes urgent care, medication refills, de-escalation, assessment, observation, treatment, and linkage to service. Part of the crisis center will also be a crisis stabilization unit. This is an additional crisis stabilization unit for our community, and it offers stabilization services, treatment, and coordination of care. And here are a couple of pictures from that the centers provided to us. This is the conceptualization of the crisis center. And this shows you some blueprints that they've been working on with an engineer in order to start to establish this crisis center.
Good afternoon, Council. I'm going to pick it up from here, talking about our clients served. So I've provided the last complete calendar year of numbers of clients served here, and we do provide an update on these numbers quarterly to the county as well. And you can see that this year we are on track to see similar numbers to the year before. And our main areas of focus are treatment, crisis, prevention, and recovery services. So in 2023, we served 7,387 clients with a mental health or substance use disorder treatment. In prevention, the count is 67,498, and then there are multiple categories of crisis and recovery supports. We do expect the number of calls to the crisis hotline to be a little higher than last year once this year closes, since we're already at over 50,000 calls by the end of October. And that's a pattern that we're seeing year over year recently, more contacts to the crisis system. So this year we conducted, in partnership with Rama Consulting, we did a community needs assessment, and it found a number of trends. So under mental health, we're seeing an increased mental health need overall. And when you look at youth mental health in particular, there's a great increased need, not only of the number of children or adolescents who may be seeking care, but the level of crisis that they're in when we first see them. We also saw an increased anxiety and depression from the pandemic impact. Some of the studies that connect to that relate to the long-term effects of a natural disaster. You can kind of think of the pandemic as being a very long natural disaster. Sometimes you'll see years later increased depression, increased PTSD, increased anxiety. We are seeing lasting effects from that kind of collective natural disaster that we all experienced. And then, of course, access to services. I'm going to talk a little bit more about workforce in a moment, but access to services is always a challenge that we're trying to meet. One good note that they are seeing, that the community needs assessment was showing us with mental health trends, is that there really is a reduction in stigma. The education and awareness that we've provided over the years and just the acceptance of these challenges that people face means that stigma for seeking care is reducing. And there's also increased awareness about it, which means that people may be seeking that care that they didn't seek before, again, adding to that increased need for services because people who may not have sought out that care are willing to seek out that care. And that's good news. So substance use trends, we're seeing increased fentanyl use, a shift toward opioids, rise in synthetic drugs, increased marijuana usage, and increased polydrug use, which just means that people are using more than one type of substance potentially together. So, but really, if you take a look at what all of those are pointing to, it's really pointing to increased need and increased symptom severity overall. So what are the actions that we've taken in meeting these needs? For this year, for our budget process, we revised our RFP process for calendar year 25 funding. So as you know, we've had tremendous opportunity. The the crisis areas that Felicia highlighted, these are new, newer expanding areas of our crisis continuum. That's something that we've worked towards for years. That's a good thing. So you know that we're already investing in crisis services, which is sometimes people's first contact with our system. But also, because of those changing trends for children and families, and because of increasing need overall, we focused our RFP process specifically on children's behavioral health services and certified prevention services. We opened it up to new providers to apply, and we also asked our existing providers to look at that community needs assessment and the changing trends and to reimagine or update their programming accordingly. So that process just concluded at our November general meeting, and we'll be in the process of issuing contracts there soon. So I said I was going to mention workforce. So next, of course, has been focusing on workforce investment in partnership with the state. Needs increase, but the workforce to serve those needs is not increasing at the rate it needs to. In fact, the state did a landscape analysis of the entire state of Ohio behavioral health services. The demand for behavioral health services increased 353%, while the workforce only increased 174%. So we are adding to the workforce, but it's not enough to close that gap. And at the ADAMHS board, not only have we been working with the state, but we've invested in local workforce coalitions so that we can all work together to really address a very complicated problem. And also, we've continued to invest in harm reduction because we're seeing good results from keeping people safe until they're ready for treatment. And we are really steadfast that if we see some things moving in the right direction, we need to keep our foot on the gas and not assume that the destination has been reached there. So thank you for that. We're available for any questions that you have.
Thank you very much for your presentation, and my question is whether you're requesting that we reauthorize the subsidy that was projected for 2025 for the ADAMHS board.
Yes, that is our request, to continue with the same funding level for 2025 that we had in 2024.
Okay, thank you. Yes, Councilman Kelly.
Thank you, Mr. Chairman. Thank you for the presentation. On your cash balance analysis that you did earlier, the expenses were around $15 million more than the revenue on that. So if you're down to your projected year-end balance of about $7 million, how are you going to fund this in the long term if that trend continues?
We have been talking about that. We're going to have to make some tough decisions in terms of what programs we continue to fund beyond the 2025 budget year. So we are taking that into account. We're doing some long-term planning and strategizing about how to continue funding essential programs.
Okay, thank you.
Other questions? Ms. Conwell.
Through the chair to Felicia, once a crisis center is in full operation, who will provide the operational cost on an ongoing basis?
The ADAMHS board has committed to providing operational costs to continue the services at the crisis center.
Do you have an estimate of how much those would cost?
We are still working with the centers on what the actual budget would look like. The crisis center will likely not open until the end of 2026. So we are working with the centers to see what a budget would look like for operational costs.
Some years ago, I don't remember how many, but there was a lot of advocacy from the ADAMHS board going down to the state on their needs. And I know that the state used to provide a lot more funding, and as they decreased, we kind of tried to, on the county, pick it up. In going forward, what has been, have you sent any lobbyists or anything like that down there to try and increase the funding that you guys get from the state of Ohio?
Councilperson Conwell, I'll take that one. The policy and advocacy coalitions that we have that we're working with are very well aligned with what the priorities of the state are right now, because we've been focusing for a long time on increasing those crisis opportunities, increasing those workforce opportunities. So we have not only our established and ongoing advocacy that we do through groups like the Ohio Association of County Behavioral Health Authorities, through the Mental Health and Addiction Advocacy Coalition, but we also have very strong relationships with our individual representatives who not only do we contact them for advocacy asks and to really clarify what's a confusing and changing landscape for mental health and addiction funding. There have been a lot of new kind of initiatives that have come in because of those trends that we've seen changing. But not only do we contact them and provide that education and advocacy, but they know that we're an expert that they can rely on as well. So there is a lot of communication. There's a lot of communication back and forth. And really, I think we've been overall fairly encouraged by how much our local needs have been aligning to some of the initiatives that we're seeing at the state, and that's precisely because we raised our voice and said over and over and over again what it is that we really need to see here. And so some of those workforce initiatives are some of the things that we exactly advocated for, and then we're trying to make sure that our community is able to take advantage of those things. So I would say that, we've always been a strong advocate. We're always out there educating, communicating, talking to the decision makers. But I feel like because the trends are changing so quickly, that's probably more so rather than less at this point.
Through the chair, it was stated earlier that mental health is on the rise for our youth, which we're very much aware of. How is the ADAMHS Board prepared to assist the county with this increased need?
Sure. So right now, like I said, there are so many different kind of changing pieces to this. The state has introduced different initiatives for crisis care for youth in particular. So we've been working and coordinating with those kinds of efforts to be able to make sure that that every child who needs that care and assistance can get it, but also can get it in the right time frame. So there are initiatives that are very quick response to a young person's needs. So we've been coordinating with those things. And like I said, taking a look at our children's and our children's programming to say, okay, it's a new world for these kiddos right now. How is it that we can adapt this programming to make sure that we're doing the right thing for them in the moment? So I think there have been really good collaborations. You mentioned how do we work together with the county on this? Obviously, we've been looking at kind of collaborative approaches for serving those high-need children that are across the different child serving systems, and there are some new initiatives in that area. But also I think that kind of ongoing education and the receptivity to it, that I know that you're all advocates for the young people of our community and are willing to speak about mental health and addiction issues as they affect the family and as they affect young people. I think that's part of the reason we've seen in our trends report that the stigma of it is going down. So we are absolutely committed to continuing to partner to carry that work forward together.
Okay, and one final thing through the chair. You spoke about there's a robust communication with the state on a frequent basis. We may have heard that there's not enough workforce to match the 353% increase of behavioral health needs.
Right.
We need to just start coming to HHS committee on a quarterly basis, and that could be 6 months. We can talk about it just so we can stay up on the initial issues that you guys are facing in terms of youth. We have a robust system that helps our adults, but the children is a growing need, and so that's a primary focus for this committee to address. So just
I
wanted to-
agree. I'll also say that there are several local workforce-focused coalitions. They tend to focus on the children and the youth workforce. Now, as the Adams Board, we're always going to be advocating for all people, all ages, all demographics, and making sure that all of those efforts fit together. But we would very much welcome being able to come and kind of share what's happening, not only with those local coalitions, but statewide efforts and other efforts that we're doing that start as early as 5th grade to get people interested in a career, and then also trying to solve the workforce issue that we have right now. We would very much welcome that.
So, for the record, Vice President Stevens and Councilwoman Simon have joined us at this time. And I have a question following up on Councilman Kelly and Councilwoman Conwell's questions. It's regarding the crisis center. Councilman Kelly accurately described the challenges that you have about the sustainability of funding going forward. And my question is whether the operating cost for the crisis center will be an additional expense in addition to what you're already doing, or would that operating cost replace other existing expenses so that there would not be a net increase in expenditures required?
To the chair, optimally, we will, as I indicated, we will be looking at our entire system that we fund to determine if there are any things that no longer meet our funding priorities. We will be taking a look at things like that. We may have to reimagine what we're paying for. We don't anticipate coming to ask for additional funds. We'll have to live within our budget.
So, my question is whether the cost of running the crisis center, is it a new expense? Is it something that you haven't provided these services in the past?
To the chair, it would be a new expense. It may replace some programming that we're currently doing, but it would be a new expense overall, but some things we may phase out as we introduce the crisis center.
Other questions by my colleagues? Council President Jones.
Thank you, Mr. Chair. Again, my questions are again around as Councilman Kelly and the chair, the $84 million of expenses. Give me a little history. Have we been spending, Adams, we've been spending more over the years, or is this a aberration the first time? Give me a sense over the last few years if we stay within budget or if it's been over.
We have stayed within our approved budget. Our board of directors approves a budget each year, but the last few years we have been spending down that cash balance. So we have been tapping into that cash balance to meet the needs of our programs. The total amount that we're anticipating for this year is roughly about the same amount. It was a little bit lower, maybe $1 million or $2 lower last year, but it's roughly around the same amount of total expenditures.
As I wrap my mind around over the years, what Adams Board does and how you deliver the service, I kind of use a thumb rule of $70 million and maybe 70 vendors that you give those monies to, and maybe those are off. Obviously, it's a number I've used over the years, 70 and 70. I kind of imagine you give maybe about $1 million on average to every vendor. But the challenge or my question around the challenge that you face is being fluid enough to work with the mix of, again, 70 vendors or so to meet the needs of the community. The challenge, and we have it at the county many times, of always staying with the same vendor You know, it's any business. I've had to fire people, and it's hard, but you have to do it. So the question is really, how sedentary have we been with again, making up of 70-some vendors that are getting your dollars? How do you, again, you're $15 million over, and it says you've been doing this for a few years. That means you only have $7 million left. So next year, something's going to give. So the question is, how do you really address changing the mix? A vendor who has gotten a contract for years and then turning around and telling them, we can't fund you this year. How do you look at it? How do you, bite the bullet and say now we have a youth issue, mental health, and you've done great work, continue to do great work, but now we need to move where the trend is moving. Speak to just the challenges or the strengths and weaknesses of the organization in terms of making the changes necessary to the vendors who have gotten contracts in the past and may not get them in the future.
Through the chair, yes, how do we look at that? Very carefully. It has been a challenge. As Claire indicated, we did let out an RFP for specific programming for this year. In the past, we would just do a general RFP for all programming, all funding. We're starting to look at it as a more targeted approach. This year, we looked at children's services and prevention. In the past, we may fund some programs that are prevention programs. They're great programs, they sound good, but they're not certified prevention programs. So for this year, when we let out the RFP, we indicated that you had to be a certified prevention program. So that did allow us to have the ability to make a change within our prevention programming. Some of the providers may not be the happiest with us right now, but if you're not a certified prevention program, we're no longer going to fund you. So we're taking a look at it from a targeted approach, service by service over the next few years to help us to really get to the optimal mix of providers and what programs we're funding.
Okay, so I appreciate what you're saying, but what I'm also hearing is that you built in the youth component of mental health, but you didn't let something go. So now it's $15 million over. You've added on, and but you didn't cut. How did that not happen?
Sorry. Through the chair, so what we did in addition to letting out the RFP, we really taking a look at the last couple of years of actual utilization of the funds. So if a provider, say a provider had a $100,000 contract and over the last couple of years, they really didn't fully utilize it, well, those providers received reduced contracts for 2025. So we're really trying to right-size some of those programs. So while we did bring in 1 or 2 new children's programs, some of the other programs may have received reductions because they just have not proved to us that they're utilizing the funds in the manner that they anticipated that they needed them.
When you have those conversations around the decisions of funding and not funding and choosing, give me a kind of a peek into the window of how you and when you do that. Is this done by the board, and at what time of the year do you make those decisions around what the new mix will look like for the next year?
So this year we let the RFP out for 2025 funding August 1st. So we advertise what our needs are. We indicate what the providers need to do to answer that RFP, and we put all the requirements and specifications out when we did the RFP.
Okay, all right, thank you.
Councilwoman Conwell is next.
Thank you. Through the chair, all the providers for MH are going to be realigned and reduced. I believe we had that conversation here with the CEO. Is this cost savings going to assist with the cost of the crisis center?
Yes, that's our plan. That's through the chair. Yes, that is our plan as we look to start funding operational expenses for the crisis center. Anything that we are able to reduce by streamlining, we will use those funds towards the crisis center.
And through the chair, Do you have an estimate of how much savings you will have with the new utilization formula that you have?
Through the chair, at this time, no, we don't have an estimate for savings.
Any other questions? Okay. Thank you very much.
Thank you.
So, before I call the next person, I'm just going to note after the next presentation, we're going to have a short break so that we don't have to go for 4 hours straight. So, next is Director Fletcher, Division of Children and Family Services.
Mr. Chair, I would like the record to reflect that Ms. Simon and Ms. Stevens is in attendance.
It's on. There we go. Do I need the clicker? Jacqueline Fletcher, Division of Children and Family Services.
A little bit louder.
There you go.
Thank you.
Okay. Good afternoon, council members. Jacqueline Fletcher, Division of Children and Family Services. Happy to be here today to kind of go through a little bit of our budget highlights for this year and next year, and then to answer any questions anyone would have beyond that. Let's see if this. There we go. So just to start, I'll just give a little bit of an overview. Many of you guys are aware of the work that we do at the division, and really our critical work is just to ensure children at risk of abuse and neglect are protected and nurtured within a family and with the support of the community. We've also added some years ago as we strive to end the overrepresentation of people of color in the child welfare system. Some of the highlights that I'll note here, just one, we have served over 21,000 kids so far this year. And our revenue sources are varied, including some non-grant funds to support adoption subsidies, child enrichment programs, as well as youth transitional services. Again, with the largest contribution coming from those Title IV-E funds that support our kids in out-of-home care, foster care, guardianship services, and things like that. Expenditures for fiscal year 2024 are expected to surpass last year's spending, primarily due to what we're seeing as an increased cost around our placement rates. And then lastly, I'll highlight the workforce recruitment and retention strategies that we have been adopting. Those efforts have positively impacted the agency's compliance with safety, permanency, and well-being standards contained in the Ohio Revised and Administrative Codes, as well as the Federal Child and Family Services reviews. So here, again, I like to highlight a lot of the work that starts at our 24-hour kids hotline, which is, again, central and paramount to the work that we do. We had a total call volume that we've answered so far, January through October, over 35,000 calls answered on our kids hotline. We're averaging around 113 calls a day. And so far, I believe this data is from January to October as well. We've screened in 45% of the calls. And again, I spoke prior to this convening about the work that we're doing to bring in alignment our screen-in referral rates closer to the state average. The state average on screen-ins is around 33%. We have hovered in the 60 percentile range for years, and so we're bringing that closer in alignment with the state's average. And then I also wanted to note for you all the new custody episodes between this same time period. This slide that you're looking at, the count of new custody episodes at any point from January to October in each year. And as you can see, that trend is going downwards. Again, I believe 2023, we did see our biggest drop in new custody episodes. And again, here, just wanted to really briefly highlight the revenue sources, as I mentioned, is mostly 4E funded. And that 4E funding supports the foster care adoption assistance, guardianship programs. I'll just pause here just to say too, with the adoption supports, we just celebrated with our adoption families this past Saturday, and we finalized 165 adoptions so far this year with 180 plus pending adoptions. So I always like to call out that good work that our staff are doing to get our kids in their adoptive homes, in their forever homes. And so I just wanted to highlight that. And here, just wanted to highlight, much of the budget goes to our client services. The majority of the kids receiving services following the agency's response to a concern are receiving those services in their own homes. So that's over 3,000 kiddos in their homes that are safe, receiving services such as our mental health services, parenting supports, youth mentoring, and things of that nature. And those are critical, again, to keeping families safe together versus coming into care if that's not necessary. And so again, the majority of our kids are placed in a family-like setting. 81% of our kiddos are placed in a home-like setting. Kinship care does represent 28% of the placement types. This next slide, I wanted to really highlight, I know when I came before you all, just talking briefly about, the work that we're doing with our personnel. So for 2024, we have an authorized FTE count of 732, with 390 of those positions dedicated to our caseworkers. And as you can see, wanted to also highlight just briefly what we're doing with the recruitment in terms of the number of caseworkers that have left the organization versus those that have been hired. And so, so far this year, we have seen 54 leave, but we've also hired 81 staff. So we're continue to work on that. We're also looking at attrition rates as well. And I will just point out that, as you can see, we're keeping them longer. So we're working really hard, and I will shout out our training and our PEI resources. They're doing a great job of supporting our new candidates as they come on board. But I also want to highlight that, part of that success is the increased starting wage. So thank you for your support on that. We really, really appreciate it. The timing was perfect. I also wanted to highlight that award that we received from the state through our PCSA of $1.4 million to help with the workforce. Again, we went to our staff to talk to them about what they want to see if we were to receive this grant, and they spoke really highly about, making sure we do some upgrades into the physical space. And we also agreed to bring in a transcription service. It's called Speak Right, where our staff are really encouraged to use this transcription services to document their activity logs. And I believe we've saved over 600 at the time when we were looking at this study, 600 hours of typing time, which is huge. If you're a caseworker, you have to spend all your time typing and entering your logs, and we can automate that. So we're really working to make sure our staff have efficient tools to help them carry out this critical work. We've also expanded hiring events throughout this year. We plan to have 4 new worker classes start next year, so we're working on that. And then I just wanted to point out, one of my goals is to make sure we're recognizing our staff and our caregivers often. It's hard work that we do, and many of us are called to this field, but I do think it's important to make sure we're calling out the good work as we're seeing it. Again, we just celebrated with our families who have adopted, so we want to see more of that, and hopefully these trends will continue. So lastly, I just really wanted to point out, just as we're looking into 2025 on the horizon, we continue to see some key challenges around, capacity building for youth with complex needs. We know our kiddos that are coming to us with some tremendous harm, some tremendous mental health, psychological needs, that those youth will need us to make sure we're responding appropriately to those needs. We also want to make sure we're continuing the trends of reducing the number of kiddos coming into care. Again, we're responsible to ensure that kids are not removed unnecessarily and to return them to their homes as soon as it's safe to do so. We'll continue to work on that, but that continues to be an ongoing challenge, as well as stabilizing and supporting our workforce. Again, without the critical pieces in place to conduct the investigations, to collaborate with families, to make sure we're there when that call comes into that hotline, we have to support our staff. So we'll continue to work on that. And through some targeted investments around what I continue to push for in the prevention space is just to make sure we're prioritizing that. So meeting with our community, targeting special populations. It's my goal to sit with and hear from our fathers. I want to meet with dads to hear what their experiences are with our systems and our service delivery, make sure we understand where their needs are so that we're not missing anything. But we've conducted several community forums this year. I want to continue that, as well as encouraging our community's input into, how do we keep our kids safe and improve their health, meeting with our providers, collaborators, and various stakeholders, just to make sure we understand, again, what's going on in our communities, how can we prevent harm from happening. I need to be out there understanding what that is, and how their experience in our system is going to be very important. And so just wanted to conclude with those retention efforts will continue to be prioritized because, again, we're seeing some good outcomes. Again, meeting with our state, collaborating with the state on our key metrics. We're seeing in one metrics around safety, we've seen a 20% improvement in our progress, and that one critical measure really looks at how well we connect with families to support them around the prevention, right, before harm happens to a kid. So we're doing tremendous work in that space. The state wanted to shout us out, and so, many of us were a little shy about that because we're not often given accolades when we see, when we do some good work, but I'll get the team familiar with success. We're going to continue to work on that. So again, we'll continue the improvements that we've made, and we know we're not there, so we have a long ways to go. So that concludes this presentation, and I will welcome any questions.
Ms. Simon, followed by Conwell.
Thank you, Mr. Chair, to the director. So I wanted to follow up with your slide regarding new custody episodes where it looks like the percentage went down. You said it used to be close to 60%, and this looks like now 45%. And I wanted to see what that means and how you're decreasing that percentage point.
Okay. Through the chair to the councilwoman, thank you for the question. So the new custody episodes is a separate metrics, but screening referrals. So when a call comes into the hotline, we're assessing that call. Sometimes we're receiving various calls, including FYIs, just to let us know something about a case. And so we want to make sure what we've done is we're screening in appropriate referrals, meaning that there is some action that needs to be taken to ensure that we see that kids are safe. And again, what we were experiencing here in Cuyahoga County is our screening rates were higher than any other county in the state. And so again, we've worked with the state, we worked with our partners internally, we've retrained our teams to make sure that they're screening in those calls appropriately and we're not disproportionately impacting families, because we were also seeing that those screening rates may disproportionately impact families who may be experiencing poverty-related challenges. And so we just want to make sure that we're screening in those calls adequately and not impacting families negatively.
So through the chair, we were maybe overcompensating before?
Yes.
Yes. And do we send referrals out for wraparound for these calls that come in? Do we follow up with, hey, this isn't going to be, do you try to follow up with those families that aren't brought in?
So for some families, family in need of services, we do provide some. Again, you'll see many of our cases are in-home family services. So if we feel that there are some critical needs of that family, but there's no abuse or neglect, we will wrap them tight with parenting supports, mental health services, whatever that family would need.
Thank you.
Thank you.
Ms. Conroe.
All right, thank you. Through the chair to Director Fletcher, the plan to get remaining construction costs for the Children's Wellness Campus, what is your plan?
So I believe we have a small gap of around $3 million, and we continue to socialize this work around the state and locally, that this is going to be a critical effort to, again, meet the needs of our more complex kids. In partnership with, I'm happy to say, our current Child Serving Systems ADAMHS Board of DD, we're working with Juvenile Court to try and work on the operational costs, but in terms of getting it built, we do have a small gap there that we're working towards filling.
Okay, through the chair to the director, what is your department doing to try and increase the kinship care? 28% versus the foster care.
This is an area that I am really struggling through the chair to the councilwoman to understand the data and why those numbers are trending the opposite direction. So what I've done, one thing that I've done in terms of backfilling one of my deputy director positions is I've split some operational duties internally to make sure we're focusing on understanding why. A lot of times we're seeing that the hurdle for kinship caregivers is high. When we come to their door and we ask them to take on this huge responsibility, it's a task. And so again, we want to understand what those needs are. I talk to my staff all the time and they say, you know, they are already dealing with their own challenges. And so how can we help with that burden, whether it's buying food right out the gate, you know, stocking the fridge and the cupboards with foods before we can even get the kids there. We just want to make sure that we understand what their needs are. So we're working on understanding why those numbers aren't trending the way I'd like to see them.
I'm shocked at the numbers as well. Is it due to the increase? Has the number dropped in any way? Mm-hmm. Okay.
The number
due to the increased cost.
The cost of care for kids have gone up. I'll just say overall, we're seeing a 10% increase in the cost of care. And I will tell you that that number is actually going counter to, you'll see our numbers are going down in terms of custody. And if kids are going directly to relatives or, you know, family friends, we know, again, that's a huge burden.
Through the chair to director, is the shared services cost increasing for training services in any way? We were kind of shared in a meeting that the shared services kind of been having some issues amongst a couple of the departments. So I was just wondering if that's an increase for your department.
Through the chair to the councilwoman, I don't know what the shared service cost overall is. I know for the agency's cost, we're trying to track that as well, given some of the changes we've made and how we're working through our training modules. Again, we do receive some revenue for training, so we're offset in that area. But again, I can take a look at that and bring that back to the council.
Through the chair, just as increased salaries are important for the DCFS employees, also their safety is a top priority. Can you update this body where the administration is at this point?
Through the chair to the councilwoman, yes, we continue to prioritize the safety of all of our staff. Again, not just for DCFS staff, but any person, doing this work, public service work. Again, you want to come to work and feel safe and be safe. And I thank my colleagues who are prioritizing this with me. So we have met internally. We're meeting with our sheriffs department as well as our protective services, just to understand where the needs are, if there's any gaps in what we can do internally to make sure we're safeguarding our staff. Their wellness is critically important to us as well, and so we know a lot of what we're seeing in terms of crimes, they're happening beyond this space, and so that's also impacting us as we're coming in to work. So we are working together collaboratively to come up with some solutions.
Other questions? Yes, Councilman Byrd.
Thank you, Mr. Chair. Just a couple quick questions, Director. Curious, the printout of the Safe Children, Healthy and Stable Families page with regard to the positions and so forth. It looks like it's going very well in 2024. An increased starting wage, I'm sure, helps assist in retaining or even recruiting. But is there a main theme with so many going through attrition? Is it burnout? Does that include retirement or promotions?
Through the chair to the councilman, again, we've been looking at some of this data. Again, I am very interested to see what that is. We're losing them within the first year. So within that first year, which is hard for anyone coming into child protection, understanding what the role and expectation is going into homes, we are considered to be first line of defense for kids and families. And so making sure our candidates understand what that means. So we've done a lot to update, what is it called? We have a video that we share with new candidates when they come in to do the interviews so that they can walk through with a caseworker. This is what you will be expected to do. This is how this works. And we have lost candidates from that first session to say, okay, no, this is not for me. But we're doing more in that space to understand within that first year, that's where we were losing them because, again, it's hard work. And a lot of candidates didn't understand what that truly meant to go into homes, to collaborate with families. We're not just removing kids, but you do have to make some tough decisions. And you're not always doing it by yourself. You're doing it with a team. But that's hard for a lot of new social workers.
I can imagine. Thank you.
Thank you.
Anything else?
Just a question.
Yes, please go ahead.
So it's hard decision-making, balancing out. That's why it's difficult, right? Yeah, it's a very tough decision.
It's a very tough undertaking. Again, these new staff, they're supported from the minute, they say, yes, I will commit to this work. And we know it's hard, so we provide them with a team. We do a lot of shadowing opportunities before they get their first cases. We take them out. We actually have them go over to court to sit in through some mock court sessions to see how that would go if they have to testify and things of that nature. But again, if we can get them through that first year with some solid experiences and a ton of support, the likelihood that we can keep them and continue to work on developing those staff, the more likely they'll stick around. So we're working on building that continuum out. Thank you.
So, Director, what's the total expected construction cost for the Children's Center, and when is it expected to be opened?
So I have to look at the updated slide decks in terms of the total cost. I believe we were looking at somewhere around 14 million, but I could be wrong, so I'll circle back around and send that out to you. But I do believe we're looking at the top of the year, sometime in January, those first two units should be coming online. So we're hoping to transition kids that are currently in those short-term emergency childcare, which we were calling the T-Suites units. We're going to be transferring those kiddos to secure settings just to make sure those kids are, one, receiving the therapeutics that they need when we're transitioning them from Jane Etna. I will tell you, we didn't have any kiddos in the building at all this weekend, so we're working really hard to reduce that footprint, but we're hoping that January 2025, we will have the first set of units coming online.
And when it's completed, what's the anticipated annual operating cost?
We're working through that as well, because what we're also trying to do is right-size it. We don't want to build an expansive operation if that's not the need. But when we do, because the the proposal that was submitted gave us 58, I believe it was 58 beds. That's also including group homes. So we wanted to make sure, if that's the need, that those are built with the need of Cuyahoga County in mind. If we still need that level of care, we want to make sure those are operationalized at some point, probably in 2026. And so we have to look at what that cost is. Probably going to be a phased-in approach. And so the first year of operating expenses for 2025 will probably be predicated on how many units we can get online.
And finally, on this topic, where's this facility going to be located?
The facility will be located at the Lorraine location. It's being repurposed for as the Hope Campus. Right now, it's the Cleveland Christian Home location on Lorraine.
I know where that is. Okay. Anything else? Yes.
Through the chair to Director Fletcher. So this is going to be a tight juggling act. So maybe in the first quarter of 2025, a reporting of the cost savings for out-of-town placement and those things for HHS committee, because I know it's going to be a juggling act when you open and things like that.
Through the chair to the councilwoman, so for out-of-state placements, you want to make sure okay.
And then, as you said, as you stated, T-suites that actually cost a little more to place a kid, those costs should come down. So, well, yeah, we'll have to juggle that and actually see where the savings will be.
And if I can get some prevention dollars, I'm really going to advocate for that, maybe not in this budget cycle. I have to move some things around, again, juggling, but if we can get some prevention supports and some dollars into Cuyahoga County, I'll really be looking at that just to kind of offset a lot of the out-of-home care expenses that we're seeing.
Is there a dollar amount?
We're analyzing the need right now.
Anything else? Okay. Thank you very much.
Thank you.
We're going to take a brief recess until 3 o'clock. Minutes. Committee of the Whole 2025 budget hearings will please come back to order. And before we have the next presentation, I would like to ask Ms. Simon to briefly present an amendment that she's interested in so that we can all hear it and know what it is and have a day or so to think about it.
Okay, yeah, thank you so much, Mr. Chair. So this amendment I'm introducing for people's consideration is a $65,000 allocation out of the HHS budget for the purpose of funding Family Connections for one full-time employee at the Community Resource Center, and that's at the Cleveland Food Bank. If you all recall, we established this resource center at the food bank, and one of the participant partners was Family Connections, and their role throughout the community, and Shaker Heights is one of their flag star places, is they have a place for families to come. It's called Family Playroom, but it's more than that. It's teaching literacy and starting to make sure that the family, all participants can read. Part of that is the Spark program. And what's happened here at this food bank resource center is the demand is way exceeding their capacity to serve the families that are coming in. This is an obvious place for families to come to get food, and the kids end up in the family playroom, and they're bringing in more families to participate in the wraparound services and the reading time. So I'm asking council if they would consider $65,000 to help fund a second person to staff this enormously successful program at the food bank to make sure it can really maximize its role in the community. So that's for people to consider overnight. And if you recall, we spent a lot of money on the literacy co-op last year, which provides books. But this is really the core of enabling families to use these books and be able to read to their kids. So this is the second piece of this, and I hope council would consider it a modest request. I understand the budget's overwhelming, but this will go a long way.
So, Councilman Tron.
Though I realize we're not in a formal session where we moved and seconded, I can tell you I know this firsthand very well because it sits right next to my office as to the acceptance of what's going on at that facility. It is getting unbelievable amount of action and activity out there. It's just it's well attended, and from that standpoint, and so I would encourage and support this when it gets to that point tomorrow on the floor. But I could just tell you that this concept, as a matter of fact, I think that this body's going to have to look and see, can they redo this concept perhaps someplace else in addition, because it is so successful over at the food bank that perhaps it needs to be replicated on the west side or some of the other places, because it truly is working. And Kristen is a good friend of mine who runs that, and it's being well accepted.
So, Councilwoman Simon, am I understanding it correctly that Family Connection started by participating in this program and sending one person, but what they're saying is we need more, and we don't have the resources in our agency to properly fund it, and we're asking for the county's assistance?
Correct. The demand is has outgrown their capacity very quickly.
Any other questions for Ms. Simon? Thank you very much for bringing that to our attention. And now I'm going to call forward Director Merriman, and I would like to mention to everybody that we were expecting Kevin Gowan, our director, to make this presentation, but he's developed a very quickly occurring medical emergency and is not able to present today. So Director Merriman's going to present it on his behalf and answer our questions. Thank you, Director.
Good afternoon. David Merriman, Director of the Cuyahoga County Department of Health and Human Services. I'm going to start the slideshow here. As the chair said, I am not Kevin Gowan, and I know Kevin Gowan is watching. He feels it's unfortunate. He feels bad that he can't be here today. He was ready to go. He developed the presentation. He shared it over the weekend, and he has extended an invitation to meet with any of you as individuals or as groups to talk through today's presentation. Any questions that I'm unable to answer, he's gonna get an answer back to you as quickly as possible. And he's healthy, he's fine, he's well. He just was not going to be able to present due to an unforeseen medical issue. I also just want to acknowledge for some of the council members that I haven't had as much chance of much of an opportunity to work with. Prior to taking this position as the Director of Health and Human Services, I was this Assistant Director, and prior to that, I was the Job and Family Service Director. So I served in this role for a number of years under the prior administration. So this is work that I feel confident in my knowledge about. Kevin and I speak throughout the week. I would say after DCFS and the children in the building room, this is kind of my number 2 area of attention and focus, and most likely then followed by homeless services. And so this is something that I focus a lot on, and I'm happy to be here today to present. So what I thought I should begin with is just an overview of the Job and Family Service Organization. Its budget is $100,378,049. That's what's proposed, and with a proposal of 853 FTEs. And that organization includes 3 major programs, and we'll be talking about those shortly. The funding for Job and Family Services is a mix of federal, state, and levy, and the Health and Human Service levy covers the mandated share that is needed to draw those federal and state dollars, and also matches some additional SNAP and Medicaid funding that we are able to draw in excess of what the state otherwise provides us. And although our total reimbursement varies from year to year, I understand from Kevin through Walter that we reimbursed most recently around 84% of our expenses with federal funds. So we do a very good job of drawing our dollars wherever possible from the federal government directly through the state, and on occasion transferring from other counties. And I think, the other thing I would just point out is I know that Walter Parfiowicz understands our organization very well. He worked for me as the fiscal officer at Job and Family Services. And he developed the DHHS fiscal officer, Kathy Starks, who's in the back corner. And she too worked in Job and Family Services for many years before transferring to become the DHHS fiscal officer. So this is the top sort of complicated federal environment that we have in DHHS, but we have a team that's up for the challenge. And I'd like to touch on federal and state funding towards the end of the presentation, but I want to get into the services. I think a lot of questions about Job and Family Services these days and our ability to maintain contact with residents. And our primary means for engaging with the community is through a contact center, an eligibility contact center. And the staff that are working on that contact center are, for the most part, eligibility specialists, which are positions recognized by the state as the entity or the individuals that generally determine benefits. And on a given month, we field about 60,000 calls. These are not 60,000 unique individuals, but 60,000 calls. And so quite a few of those calls are repeat callers that are either asking a customer service question, following up to ensure that we receive documentation, or just trying to learn about programs. The vast majority are people that are calling to learn about are they eligible, and our hope is to be able to give them an answer when they call. The goal is for a one-touch resolution, and that continues to be a high priority for us. I can say that about 85% of the residents calling on a Medicaid issue are getting eligibility, and they get through. And I think we do a great job maintaining the balance of staff to ensure that we are able to address callers with Medicaid case questions. I think it gets more complicated when you get to SNAP, and I'll talk a little bit about the difference of the populations shortly. But a lot of the issue becomes that SNAP requires that there be a paper application, that requires an interview, it requires follow-up contact, and unfortunately, SNAP has become more complicated as additional federal and state policies have been implemented. So our call time interviews are up to 45 to 47 minutes per call. A few years ago, they were closer to 34 minutes per call. And what we know is that we're spending more time with the people that are calling us, and that is unfortunately having a delay for folks that are still waiting to be spoken with. At the end, I'll talk about some ways in which we're going to assess if this is the best model or there are other models, but I'm just going to move through. So the core programs, as I mentioned, for Job and Family Services are SNAP, Medicaid, and TANF. And like I said, SNAP requires a phone interview and then a 6-month check-in. Unfortunately, many residents don't follow through with that 6-month check-in, and we tend to track that, and we push those engagements, but unfortunately, if a resident doesn't follow through, the state is very efficient at terminating their benefits. The system that we work in is called Ohio Benefit Worker Portal, and this is a state system that's managed by the state, that was developed by the state, primarily for Medicaid, and then it was expanded to include SNAP. And it is extremely efficient at recognizing when someone doesn't meet the qualifications for either program, and it terminates their case. And I think in doing so, what we recognize is that many residents will then go to utilize their SNAP benefits. They'll find out they don't have them, and then they'll come back and reapply. And that churn ends up causing a lot of the delays that we have when we're, I think when we're otherwise hoping that people will respond to those interim reports and that 6-month follow-up. For Medicaid, it's a very different story. In fact, many Medicaid applications are no longer touched by our staff. This is referred to as passive renewal. When the state implemented this new system, then federal policy changed. They were able to determine that if a person's conditions don't change dramatically, they can actually be passively renewed from one year to another. So as an illustration, if someone is in their early 80s and they're on a fixed income and they're retired and nothing dramatically changes, if in 24 they're on Medicaid, there's a high likelihood 25 they'll be on Medicaid, and they can be renewed from one year to the next without actually talking to us. And so passive renewal has really grown in its effectiveness, and I acknowledge the state, I think, has done a great job of implementing that program. So we're now seeing less Medicaid work, but more SNAP work, given the complications of some policies that I'll be speaking about shortly. The last area is TANF, and TANF funds 3 principal programs: cash assistance, and most people thought of this as the welfare check in the past. There's about 1,000 people that are actually on cash assistance that are required to do work activities. The rest are generally extended family members or people that are preparing to do an SSI application. Childcare is also funded out of TANF, and there's between 24 and 25,000 families that are receiving childcare assistance. And then every year we are able to give out some emergency assistance referred to as the Prevention Retention Contingency Program. And there are thousands of residents that access those dollars, and they're used for everything from car repairs to help a person get to a job to purchasing a new refrigerator, or at times putting down a down payment for a home. I'm sorry, for renting a home. Let me focus on our primary challenges, I think, for 2025. I think the first is I just have to acknowledge is the volume of SNAP. Every year, we have around 180,000 residents that are utilizing SNAP benefits. That is actually down slightly, and I look at that and I think that is largely attributed to that state system that effectively assesses whether a person's met the qualifications to maintain benefits or it just terminates. It's an active disengagement. SNAP also does require that certain residents engage in employment and training activities, much like cash. If you think back to the end of the welfare reform period, or the start of the welfare reform period, those work activities expectations were well established for folks that are receiving cash assistance. Well, if you don't have a child and you're not disabled, then you are actually also required to do some work activities. And those are coming back to us, and I'll share some more detail about that in a second. The other major change is there is an increase in SNAP eligibility, and this is great news. This administration has actually increased the SNAP eligibility threshold from, I believe, around 138% of poverty to 200% of poverty, with the goal that this is going to help working poor families maintain their SNAP benefits. I support this. I think this is great policy. We do see a lot of family members that are in, or a lot of households that are in jobs that have variable hours, and 1 month you could be at a level that you're able to receive SNAP and the next you're not. And I think that constant moving up and down is a reality for many workers in our county. And this higher level will actually enable us to maintain individuals as they are, as their income changes. It also will allow us to have individuals coming through the door that have a little bit higher income as well. Unfortunately, there are no new dollars to support this expanding eligibility. So we're gonna serve additional clients with the dollars that we have and the staff that we have. The next item is there was a waiver for able-bodied adults without dependents, or ABODs. And this group, the able-bodied adults, are 18, I think, to 55-year-olds that don't have children and they haven't reported some form of disability. For the past several years, they were not required by state and federal law to be reporting their work activities. And unfortunately, that ended in October. So that group now has to come to us on a regular basis and report the activities they're doing, whether that's training, it's education, some form of employment, or volunteering. And we are actively sharing data to try to find if those individuals are in fact disabled but not reporting it, if they're homeless, or if there are other circumstances that have them being able to live on around $200 a month but not disabled for whatever reason. So we're working on the ABOD population, and I think we're going to end up finding a lot of individuals that are actually homeless and some other extenuating circumstances so that we can exempt them. The last thing I do want to recognize is there is a rise in the number of reports for individuals' SNAP cards being skimmed or hacked, if you will. And I think this is unfortunately something that's common in our society, in that criminals put a device over the swipe boxes or the machines that individuals swipe their cards with that captures their account information. And what we're hearing is there's increasingly some availability of devices that don't even require the physical swipe. It can just capture it by Bluetooth or some other means. This is a concern. We're experiencing about 1,000 a month of individuals who have been scammed. And through the current federal administration, individuals that are victims of this crime can actually request to have their funds replaced. But that policy actually ends next month. So we don't know what's going to happen after the federal policy to replace the lost funds for the victims of SNAP skimming. It's something we're concerned about. We're working closely with our partners to get the word out. A lot of what we talk about is, check your balance regularly, change your PIN regularly, don't share your card with anyone. And we're trying to inform our clients, you got to keep an eye on this issue because otherwise the dollars can be taken. For Medicaid, we have more than twice as many residents on Medicaid, and I should acknowledge that most SNAP recipients are on Medicaid, but only about 50% of Medicaid recipients are also on SNAP. And one of the things that we're hearing is potentially going to come is work requirements for Medicaid recipients as well. There's actually state law that requires the state administration, Job and Family Services, to submit for Medicaid work requirements. And we expect that to go in early next year. So when that occurs, we know that there will be many more reporting responsibilities for individuals on Medicaid. Don't have any sense that there'll be any funding to do that. That will just be increased workload and increase churn, that individuals that don't report they don't report their activities, will be auto disenrolled. And then when they go to receive medical care, they'll probably be re-enrolled, and that churn creates delays in our ability to process. The last thing I have to point out is, unfortunately, the state has made some decisions to stop doing some of their processing at the state level. Through this year, they have actually been processing new cases that are coming through the federal marketplace, as well as referrals from Social Security. And for reasons that I don't understand, they've actually decided they're not going to continue to support those cases. And so those cases will start to come to us soon, which is going to increase our workload. And then for childcare, this is also great news that the state administration has increased access to childcare resources, and the childcare choice voucher has led to almost 800 individuals starting to be able to achieve childcare. And then the ECE, whose acronym escapes me as I stand here, is another form of childcare that's enabling about 1,600 families a year to get childcare. So we're seeing, I think, a commitment by the DeWine administration to fund children's services. I applaud that. And this, too, is another area where we've been able to accept this work, but also not received any funding for the staffing. And I think when you total all these up, you do see that there has been an increase in the volume, there's been an increase in the complexity, and unfortunately at times that leads to staff needing to take more time with cases. As we speak of staff, I want to just recognize the eligibility staff that are devoted to this work. The eligibility specialists are great. They're a great group of individuals. They do an outstanding job. I know that Jackie Fletcher talked about how her ability to attract and retain staff was dramatically improved when council passed the recommendation to change wages. And I think time will show that's the case for eligibility specialists as well. Our staff work both on phone, in person, and online. And increasingly, we're going to actually have more staff in our offices. So we have been bringing staff back to the Virgil Brown building. There are, in essence, 30,000 paper applications and 30,000 phone calls on a month, and these are for new cases. So we have about 60,000 new cases coming to us a month. We do know that we generally manage around a 15 to 20% rate of absenteeism, and our vacancy rate is between 14 and 17%. Hiring has been better this year. I think what was reported is we've hired approximately 100, and we've lost around 60 individuals, but that means we're netting out. We're netting out about 40 individuals. Those numbers, I think, are still preliminary, but I think it's a sign that we are actually getting candidates through the door. We're going to do more to assess whether or not they have a realistic job preview for the job and that this is the right job. And some of what we have to do is we test them. Because these are complicated federal programs, we actually test them throughout training, and they are expected to pass at a certain rate, or unfortunately, we have to have the conversation that this is not the right job for them. We do have 54 people in training right now, with 23 coming out in December, and I think another 28 or so coming out in January. And then we're expecting to start another class of 50 in January. So we are working very diligently to staff up our department. And I think the wages have helped. I also think the fact that we have a hybrid remote work schedule, I think that helps us attract and retain staff. And our expectation is that department is going to continue to grow. We've dedicated more resources to our training department so that we can do multiple trainings at a time. And ultimately, our expectation is we're going to hire 50 a quarter until we're at our full amount, and then we're able to actually serve the volume of residents that are calling us. I want to acknowledge one point that Kevin shared with me, and I don't have a slide on this, but I think one thing that we've heard from the state Job and Family Service Director Association is they've been tracking in 2009, so just before the implementation of council, there's a dramatic cut in funding from the state for eligibility specialists. They really slashed the amount of money they put in to the budget for us to hire eligibility specialists, and that reduced rate is sustained since 2009. And so we're probably receiving 50% of the funds that we should be. And we're one of the lowest states in America for funding SNAP and eligibility work. And that's just, I think, a legislative priority. And it does have an impact. And I know this council has been generous and given Job and Family Services employees in the past, and they utilize all those employees. But if the state doesn't make its contributions, then I think all the weight falls on us. And we're hoping that the governor's administration or the legislature adds some of those dollars and some of those staff back in their budget. We're watching. We're going to see how it goes, and we'll try to take a position and hopefully see some increased revenue for this. The last thing that I do want to point out is Kevin Gowan is actually going to be working with Deloitte Ohio Department of Job and Family Services and Director Matt Damschroeder, has brought Deloitte to several counties, big urban metro counties, and brought them out to take a look at our contact center, to look at what we're doing, and to sit with our teams. I know Kevin's already met with them, I think, 3 times, and just do some deeper dives into our processing and the work that we do right now, and look for ways for us to optimize that work. Kevin, I think, is excited about this. We have an outstanding team that does this internally already, but if there's lessons to be learned from other counties, then that's something we want to know about. And although the relationships are there between Kevin and his colleagues in Hamilton and Franklin and Lorraine, sometimes it does take sort of an offline conversation to get into a different level of detail. And so Kevin is excited about this, and I think as we jump in and we learn, we'll be making some effort to implement new approaches. And Kevin, I think, would be grateful for the opportunity to come and talk about that in 2025. So I think with that, I've ended my presentation. I think I can go off. There we go. And happy to answer questions.
Thank you very much for your presentation, and I see Ms. Simon first.
And then Kelly,
followed by Conwell.
just a question on the Deloitte consultation. Is that a contract you have with them, and how much does that cost?
It's a contract between the state and Deloitte. I don't
It's
believe there's any
state.
cost to us.
So the state's going to go ahead, at least give us that?
Mm-hmm. Yes,
Okay.
that's correct.
Yeah, good.
Yes,
Thanks.
I agree.
Yeah, Crom.
We'll take whatever we can get. Ms. Conwell,
Thank you. Through the chair.
followed by Kelly.
Through the chair to Administrator Merriman, the authorized openings of FTEs was only 43 when we had that at the beginning of the budget amendments last week. So how is your department determining 50 hirees planned for January?
So to the councilman through the chair, so the budget that was approved for us in the last biennial budget, I think, wasn't able to fully address our needs. And so Kevin took a request to the chief of staff, who approved hiring a portion of it. And in essence, there was a challenge here: get to this level, add 50. If you can get it and you can stay at that level, come back to me and we'll add more. And so the intent is for us to hire, to demonstrate our ability to hire and retain. And I think if we can demonstrate that, I think we're going to continue to propose to add staff and make decisions about if we need to move from other areas in the department, we'll look at doing that. Or if we can get some additional dollars from the state, that will be supporting new positions. But the intent and the direction from Deputy Chief of Staff or Chief of Staff Eric Janis is go hire, demonstrate you can get them through the door and you can keep them, and then come back and talk to me, and we'll keep talking about whether or not we can increase the FTE count.
Okay, this is something else we'll have to put on a quarterly report to come back to council or HHS committee in regards to, because as I shared with you in our last meeting, even though there was 43 at the time authorized, that department is not producing what they need to in terms of the calls being accepted. You did share that there's workforce issues that relate to that, and so this would actually assist you guys if you could retain 43 in better handling the calls. But I still think that we've heard this time after time, so I just want to put it on a short leash and actually watch it once we get the hirees in. So you can share that with Director Gowan. My second question would be, through the chair, 84% of federal funds are reimbursed. Has the county received all of their reimbursements in a timely fashion? Federal government.
So I believe the reimbursement structure is we submit them to the state submits them to the feds, and then the feds remit them to the state, who then submits them back to us. Is that right? I'm going to invite Kathy Starks up to answer that question.
That's a long process. We can't shorten that.
I think what I'm hearing is that we advance portions of it, and then we get reimbursement. Let me ask Kathy to first introduce herself and then answer the question.
Hello. My name is Kathy Starks. I'm the Chief Fiscal Officer for Health and Human Services. So currently, we do what's called a monthly advancement. So we kind of project out how much we think we're going to spend, and we advance, the state advances. So the first Friday of each month, I might submit what I think we're going to need in terms of that month, and we get it within 10 days.
Okay, is that for everything, though?
For everything for Job and Family Services, they are the only ones that's on an advanced system. Everybody else is on a reimbursement.
That's a lot for your office. And how many employees are in your office? Juggle that?
Mainly within just the advanced part, probably like just a couple of us do the advances.
If any of you, I mean, have we had conversations with the state? If any of you, out of the couple of you that get sick or have to go on vacation, who picks up that, you know?
Yeah, so we have a, sort of a ranking order. So I train people who can support if I'm out, hopefully not, but if I happen to be out, then I have a number 1 and a number 2 that can support the monthly advance.
Stated earlier by DCFS director, they have really worked hard on screening calls for placements. Can JFS do something similar?
So I don't want to get too far ahead of Kevin. I think some of what they're exploring is other counties have started to do something similar, and it's not screening, but it's instead of asking everyone to call us whether they have an appointment or not, what they're exploring is looking at are there individuals we should just call them, just reach out to them and to have the interview, as opposed to waiting for them to call us. So that's one of the strategies that Kevin is considering, and I don't think the analysis has been done. But I would say it's almost a form of screening, because they're assessing who would call us tomorrow? And if we have a sense that, on a daily basis, we're getting 3,000 calls, but we know 500 are those people with a scheduled interview, well, why don't we just call those 500 people? And we just put a call out to them, as opposed to waiting for them to call us. So I think they're exploring that, and it's one of the strategies that they're going to look at and see if it's worked in other counties and if it's an option here.
Councilman Kelly.
Thank you, Mr. Chairman, Director. You said that there's an increase in eligible residents, 200% of poverty. What is poverty right now?
Let me get an answer for you on that. I think I'm thinking back to my JFS days and remembering because it's a complicated question, because it's an individual plus their children, and then we also have allowances. So what I'll do is I'm going to ask one of my folks to come forward in a second to just share kind of the federal poverty level for an adult with 1 child. And I don't want to use a number and be inaccurate, if that's okay.
That's fine. I appreciate that. Talked about a rise in skimming for the SNAP. Have you heard of any other cheating going on with it, where the card is maybe used somewhere and then they might get cash at a reduced rate for that card? Have you run into much of that?
That happens. That does happen. And I'll just share, we have 20 fraud auditors and investigators that report to us. This is our choice to have these staff. And before the skimming was a feature, that was one of the main things they looked at, is that form of fraud and other forms of fraud. So it's something we take very seriously. We investigate, and we are committed to working with law enforcement to prosecute where possible.
Thank you.
So I got an assist from Dan Humphrey, who is the administrator of our Performance Evaluation and Innovation Office. And so for a family size of 1, 100% of poverty is $15,000 a year. And, I just do 150% of poverty is $22,000 a year. So these are very low wages. And so again, for this a family unit of 2, which is much of our population, single parent with a child, that 150% of poverty is around $30,000 a year. So this is probably an individual is most likely making less than $30,000 a year. And that's for 150%, but we do kind of recognize that people have to live somewhere. So we'll give them an allowance towards, or a credit towards their apartment if they have an apartment. And so some of these figures get complicated, and this is one of the biggest jobs of eligibility specialists, is to meet with someone and say, okay, so you have a child, do you have a rent statement? Okay, let me take that off your income. And then do you have to get to work? What's your car payment? So they really look at these to try to assess how much a person is actually making to try to fit them in these programs. They plug the information into the data system, and then the system actually largely tells them if they're eligible or not.
Thank you.
Other questions?
Just one quick, if no one else.
Please proceed.
Do we give recipients a one-time, if they're in, crisis payment, any kind of voucher like that?
So
like for rent or something, if they're once a year end up in trouble?
To the Councilwoman through the chair. Yeah, so the Prevention Retention Contingency Fund is the one-time payment that is available, but that's largely for families, and that's for families that are TANF eligible. So it's not available to everyone, and it is limited in terms of its sources. Its uses. So it can be used for some things, but not others. There's a lengthy list. Every year we ask for community input on what should be included in the list, and we submit that to the states, and then we have the funds. I can tell you the vast majority of funds are used for housing in one form or another.
So, Director, is there potential to make greater use of online processing effectively, or does the requirement for paper applications and phone interviews make that not a possible approach?
So there is potential. There is, and we are talking to two different organizations about, are there things that we could do to change residents' behavior to utilize existing technology or to develop new technology? And there's a self-service portal that's provided by the state. And I just want to acknowledge, I think the state has been a good partner. This administration has been, Matt Damsholder has been great to work with, Medicaid as well. The self-service portal is not great, though. It is not really designed around a customer experience, and there's no provider portal. The old system, I'm told, had the ability of a provider to enter information on behalf of a client. And these are kind of known limits and barriers within this system. And we would need the state of Ohio to step up and make those changes. And we hope that they'll do it. Although I want to just say, I don't know if they're watching, but if they were, I would say I would rather the state invest in our staff than invest in technology. And we've said that clearly. We need employees. And if they have a choice between another multi-million-dollar IT system or having more staff that can answer the phone, at this point I would ask for answer the phone.
Can these problems be fixed without state computer systems being upgraded?
That's a challenge. I don't want to say no. I think our goal is to look at new partnerships. I'll just tell you one of them, we're talking to United Way about, is there a way for us to utilize 211 to push information out as opposed to waiting for someone to call us to ask for a question, ask a question that we would answer. I think there's ways for us to use technology to engage residents in a more meaningful way and to change their behaviors. At the end of the day, this is a state system. In our structure in Ohio, we're state supervised local administrators. That means the money comes to the state. With it goes all the administrative dollars, or most of them, to buy the different data systems, and then we have to use them if we want to do the grants. And so we would need the state to make most of the changes to have them be really meaningful, deep system impact.
You stated the absenteeism rate is 15 to 20%, which is almost 1 day of absence per week. That seems like a very high rate. Can you comment on that and what's being done to address that?
That is an average, and so that does also take into effect FMLA and folks that are on vacation and other forms of leave. So I actually feel that number is being managed as we have newer and newer employees. They don't have the built up vacation time that someone that's a veteran employee may have. But at the same time, when somebody files for either medical leave or if they file for, or if they call off sick, I mean, these are rights that are kind of included in their contracts and in our personnel practice. And although we work with them to understand what's going on and want folks to understand the impact of being away from their office, we also understand that many of them there's a lot of parents with young children that are in our workforce. And not only do they have their own medical needs, their children do as well. And that's a reality of having a job where you do really understand that there's a balance here between what I think of as the ability to have a great impact on the community, but also provide a household and provide your children for what they need when they're sick. And I think we see that. I think we've got a lot of employees with young children.
Final question. If you were to give your opinion on what would be an acceptable standard for two statistics, the first would be the average amount of time that it takes for somebody to access the contact center and reach somebody, and the second statistic being the time at which 95% could reach the contact center in that much time or less, so that you're excluding only the real outliers. What to you would be a reasonable standard?
One, I'd like Kevin Gowan to answer these questions formally on our behalf. He's got the data and the access. And so if you would allow us, I'll get you an answer to both of those questions. What I would like to say is there was a period where Kevin piloted an approach, and what he was able to show by taking staff off paperwork and just answering the phones, he was able to get most people's calls answered in 30 minutes or less. But then the problem is that if a resident calls and we can't determine their eligibility on their call, then there's no one to do the follow-up paperwork. And so if you're okay, Councilman, I'd like to get Kevin to answer this question, and we'll have a formal answer back to you.
Okay, well, I have my own opinion, but I want to see how it compares with yours. Okay. Any other questions? Okay. Thank you very much, Director.
Thank you.
Okay. So last but certainly not least, I would like to call forward our distinguished Director of Senior and Adult Services, Director Natasha Petricola.
Good afternoon, Council. Natasha Petricola, Director of the Division of Senior and Adult Services. So as you all know, the Division of Senior and Adult Services' main purpose is to keep older adults and disabled adults aging successfully, gracefully, and healthy in their homes. We provide services to those 18 to 59 who are disabled and anyone who is 60 plus. We do that in a variety of ways. We have our clinical programs, which is where our Options program is housed. Options provides 5 core program areas. They do homemaking, personal care, home-delivered meals, transportation, medical alert. We also added a laundry contract because we were having difficulty finding homemakers. So that was part of the dollars that this last RFP that went into getting some support for older adults in the home. And we also have our homemaking program through our home support division. We have nurses who go out. They provide medical care on a monthly basis. They check on the clients, and then the family service aides are the ones who actually go out and do the homemaking and the personal care. Our community programs consists of adult protective services. That's the safety net for anybody that we suspect 16 and older or 18 to 59 disabled who are being abused, neglected, self-neglected, or exploited. We also have in there our information services program. We're an aging disability resource center. We receive some grant funding in the amount of $205,000 a year through the Area Agency on Aging, Western Reserve, to provide information assistance and benefits assistance. We also do benefit checkups through that program, where it's a screening that we check to ensure that older adults, disabled adults, receive all the benefits possible We have contracts where we work with outside of Cleveland, the city of Cleveland, senior centers, and we perform those benefit checkup screenings on a monthly basis at times. We also have some emergency funds that are allocated through that program, our bed bug program. The majority of our clients are seen through that area as well. We also started in 2022 a behavioral health unit. We noticed that a lot of older adults were not getting their mental health needs met. And so we also teamed up at that point in time because the pandemic was occurring with Cleveland Clinic, and now we've added other hospital networks to do teleassessments and geriatric assessments for our population to kind of curtail some of the need for protective service orders and having to go to court to file those to get somebody assessed. We also have our last program area, which is through my office, the director's area. We have our Office of Community Outreach, Marketing, and Strategic Partnerships. That is where we have our Livable Cuyahoga initiative. It is also out of my office where the board is, the board members are through our 25-member board. They come through our office as well as our advocacy. So my presentation is kind of short and sweet because DSAS, although we do a lot of work and we have a lot of complicated clients and services, our budget is what it is, and there's not a lot of federal dollars that come in. We are very heavy leverage through the.
You're not getting any advance on your screen. Okay, there you go.
So here's our client counts. As you see, since 2019, we have surpassed year after year our goals. This year, if you look at the 2024 numbers, we have already surpassed our 2023 numbers, and those were the counts that were through October of this year. So we are on pace to have a record year again. Our connection center, again, is our centralized intake, and we are definitely going to hit probably about 25,000 plus calls this year. That is handled through 10 staff and 2 supervisors. They do an excellent job making sure that if it's not a DSAS program somebody's looking for, that we connect them to something out there in the community that makes sense. We track all those calls, especially the ones in adult protective services. If they're not appropriate for APS, they are put in the ODAP system, which is the Ohio Database for Adult Protective Services, so that if we get a repeat call, we know that there's some history involved there. Our Adult Protective Service program, again, I don't know if this is a good thing or a bad thing, but it shows more people are reporting. As you can see, we are definitely going to surpass 2023 total counts. Those are unduplicated clients that are called into APS. Our home support program, some of those numbers are a little bit lower because we do have still some deficiencies in being totally staffed with our family service aides. Our options for independent living, we've surpassed our goals of 2,000. When you start getting into these higher numbers, though, you have to figure that each one of these clients is assigned a case manager. And so we have 20 social service 4 workers in that program, and they are all over 100 clients at this point in time. Our information services unit, again, that's where a lot of our emergency, short-term, intermittent kind of assistance is provided, and we've grown in that area as well. And then in our community social service program, that's where we have our contracts with the various senior centers and programs that are out there servicing older adults. And again, we're serving more people through those contract dollars. This is a synopsis of our sources of funding. As you can see, what our projected budget is for 2025, it has increased slightly over 2024. Like I said earlier, the majority of our funding comes from the Health and Human Services levy, so that's why it's very crucial that that levy remain very popular in our community, and we really depend on that for the good of many of the older adults that are vulnerable in our community receiving assistance through our agency. And then the Special Revenue Fund, you can see that we receive a small amount of funding through that program as well. So the contracts that we have currently, we have our community social service program contracts. We have 30 providers. That has not changed. We're at about a little over $3.4 million. I can say pretty much with certainty that all those dollars will be expended this year. I know in years past, there's been some concern that they weren't fully actualized, but we make sure that when somebody's underperforming in their contract, those that are overperforming and truly need it, we do a lot of decerts and recerts. Our options program, we have a little over $4.7 million in that program. We have 23 providers. We are on track to spend every dollar of those contracts. This year, we were fortunate enough to receive an additional $600,000 to add to those contracts, as well as we diverted some of the funds through a one-time state-provided grant through the Healthy Aging Grant that was given through the Ohio Department of Aging. We took about $500,000 and also put that into the options programs so that we could support meals, homemaking, personal care, and some laundry service. The Guardianship Services Program, we have $675,000 in that annually. That money has been spent for the year, and that is where indigent people who do not have a legal surrogate or a decision maker appropriate in their life, we would go through Lutheran Metropolitan Ministries and request that they act as the guardian for that older adult. And then our bed bug contract, we have $150,000 in that contract. There are 2 providers. One provider is Speed, which does conventional treatments. They have a $90,000 contract. Terminex has a $60,000 contract. Out of that contract, about $70,000 has been spent to date this year. Some of the things that we're monitoring, expansion of livable Cuyahoga County initiatives. We have decided that we took those 8 domains of social determinants of health and we broke them up into 3 that we felt needed the most attention at the current time, and that is looking at transportation needs, housing needs, and also looking at social isolation and attachment. The demands and services for our clients, we're just trying to make sure that their needs are being met, and that we also include any other program they might be eligible for and let them be known to those clients in the event it's not something that DSAS is able to provide. Staffing needs, we're pretty good with our staffing. We have only about 8 openings at this time. We are budgeted for 168 staff. 4 of those 8 are family service aides. We have an additional 2 supervisors that we need to fill and an administrative assistant. Homemaking becomes and continues to be a challenge in our area. It's very hard to find qualified family service aides. As you can imagine, the increase that was provided to them with the last contract did help, but it's still kind of a low entry job, and a lot of our family service aides that we had for years that were dedicated have retired, and it seems that, you know, it's very competitive right now to get quality aides, but we really try to recruit the best that we can through the interview process. We have had a lot of success, though, with the applicant pool. There's been much more people applying. But we have to ensure that they're also state certified and tested and that they meet the qualifications to work with our population, because it is predominantly all in the home. And then we're always looking, obviously, for alternative funding sources. So DSAS is not going to shy away from an opportunity if a grant approaches us. We were very fortunate, like I mentioned, this past year, the Ohio Department of Aging provided one-time grant dollars to counties, and we had $3.9 million, and we spent every penny of it.
Thank you very much.
You're welcome.
Ms. Conwell.
Thank you. Through the chair to Director Petrocola. One of my greatest concerns is the Healthy Aging Grant that was $3 million. That was one time. When it goes away, what will the gap in the DSAS department be?
Right now, through the chair to Councilwoman Conwell, we used about We had a total of $1.1 million that was added to the options program. Like I said, $500,000 through the Healthy Aging Grant, and then the $600,000 that I was here last week to discuss. So if you just base it on that number, and what we did is we were able to maintain services for the clients throughout the rest of the year. You could say 1.1 million. That's not factoring necessarily growth. But we've already looked at that, so we know what our budget is because the contract's already set. So we have begun kind of looking at decreasing the meals from 10 to 15 a week to 5 per week per client. That way everybody will at least get 1 meal a day. We were able to add more in the past, but that's one alternative we're looking at and preparing for.
And will that, for the meals, will that touch all the providers?
That will. It will.
And so that's, I don't know how many years I've stated that in terms of seniors, if we know that the data is stating that we are increasing, they increase every year, the population of seniors living longer, then we should be, as a county, willing to increase that budget as well for DSAS. And I know if my colleague Gallagher was here, he'd be giving me some backup in terms of looking at what this funding should be. Now, I don't think we've ever faced this in the county since I've been sitting here where we actually had to cut meals. I think that's new. So I think I asked my colleagues to really wrap their eyes around this, because that's the first time that I've ever heard that we're going to have to do this across board. We faced the options program being a waiting list, but never the meals being able to be curbed for the family. So that's all I have to say.
Anything else? Is the meals program not part of the options program?
It is part of the options. We have several provided contracted agencies who provide the home-delivered meals, so that is part of it.
That's one of the
It's one of
programs.
the
Yeah,
5
okay.
core ones, yeah. We do about, we have 1,518 clients right now receiving those meals.
1,518 clients.
Yes, who receive meals. And these are a mix of people who are homebound and also some that just need that supplement. And obviously, they're not always eligible for the SNAP program, but they are on limited incomes. So it's around 200% of federal poverty guidelines.
So
Over.
in the absence of Councilman Gallagher, I'm going to provide some support. I'm also very concerned about this, and we're going to take a close look at this. Anything else? Okay, thank you very
All right,
much.
thank you. Have a great
Before we
Thanksgiving, everyone.
Before we close, I know that my colleague, Ms. Stevens, had some concerns about the East Cleveland, and it came up briefly during the public safety discussion. And if you want to take just a moment and share your concerns about that,
I'd like to go on
invite you to do so.
Thank you, Mr. Chairman. I'd like to go on the record and express concerns from District 10. As everyone knows, East Cleveland economy with the moving out over the last 30, 40 years of small and independent businesses, the consolidations, and most recently GE announced that they'd be reducing their on-site campus activity in East Cleveland. And we've had a series of management issues at City Hall. So there's been a request by City Council and their leadership, as well as the former mayor, about providing more deputy support and services in East Cleveland. If we can do it downtown, we can do it in East Cleveland. And so I think it's appropriate and important to obtain additional information about providing 3 or 4 days of support in East Cleveland so we don't end up with a Wild West situation on the east side of Cuyahoga County. I believe that earlier today, and I don't know if Trevor received this information or just Councilman Gallagher, there was a request for additional information on what the cost of services in East Cleveland were. Joe or Trevor, did you receive some additional information? If you'll indulge me for a minute, Mr. Chair.
Yes, please proceed.
Staff approach and talk about the request that was made earlier.
Good afternoon, council members, Trevor Meckler, County Council staff. I think that information, if he received it, went directly to Councilman Gallagher. Staff did not receive that yet.
Okay, all right, thank you. So we have some homework to do because we're not just responsible for the city of Cleveland's safety issues. We're responsible county-wide. And so it's time for us to take, if we're going to stay in the business of providing support to some of our communities who have substantial needs, then we need to take a look at who has needs across the county. And while we cannot take care of everything, we need to make some changes and accommodate those communities who have a great need for safety-driven issues. Thank you, Mr. Chairman, for allowing me to come back to the microphone after that topic was discussed.
Okay, thank you. Councilwoman Turner.
This will be considered miscellaneous. 2 weeks ago at the council meeting during public comment, we heard from a young lady named Sherry Thomas who talked about the mobile healing room and trauma response unit that she was using, particularly on the southeast side of Cleveland and the surrounding first ring suburbs. It's an innovative unit that delivers rapid, compassionate care to individuals and families who've experienced trauma, including gun violence and the loss of a loved one and other critical incidents. She will be here tomorrow at 1 o'clock. She's going to bring the trailer to the County Administration Building for anyone would like to visit.
Okay. Thank you very much. Any other budget or miscellaneous business? Okay, so just for everybody's information, we will work on this again and talk about amendments tomorrow as it's within the regularly scheduled committee of the whole meeting. And the council president had an emergency and asked me when the meeting is closed to simply adjourn the meeting, so there being no further business. Thank you very much for staying with us and for everybody's attention. We are adjourned.